When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
Every who down in Who Newville liked the holidays a ton, but where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Welcome to the Dr. Raj podcast with Dr. Raj Dasgupta, a show all about educating patients, students, and aspiring doctors about better patient care. Dr. Raj is a quadruple board-certified physician and associate professor at the University of Southern California. He was a co-host of the TNT series Chasing the Cure with Ann Curry, as well as a regular on the TV show The Doctors. And now, here's our show.
Hi, and welcome to the Dr. Raj podcast. And what is this a podcast of? You know what it is of. It's of happiness and wellness and amazing people, amazing stories. And today I have a great one. I truly do. So this is a young man who actually shadowed me, right? He shadowed me. And I wanted to be this strong influence because, I love internal medicine. I love pulmonary critical care. And I thought I had special Jedi powers to bring him to my side. But you know what? He went his own route. He's actually helping people with traumatic brain injury. And in fact, why I put him on the podcast is because at such a young age, he has his own business now. I don't even believe this. And he actually invited me to go to his grand opening. So I said, I'm going to put you on my podcast to actually influence other people. And it's a great story. So today, my guest is going to be Dr. Joseph Khankhanian. And, you know the rules. He gets a little bio first before we just jump in. So Dr. Khankhanian is the owner and clinical director of SoCal Brain and Spine Center. He was born and raised in the suburbs of Los Angeles, California, where he completed and received his Bachelor's of Arts degree in biology and bioethics from American Jewish University. Dr. Khankhanian has always been passionate about natural medicine and holistic approaches to managing health. This is why he decided to continue his education and complete his graduate studies at Life Chiropractic College West in the San Francisco Bay Area. There, he received his doctorate in chiropractic and decided to continue his postdoctoral studies at I'm going to mess this up, Carrick Institute, further specializing in clinical neuroscience and receiving his Diplomate of American Chiropractic Neurology Board, the DACNB. He has taken over 400 hours of coursework on neurological rehabilitation and functional medicine / nutrition, is currently in pursuit of a fellowship in clinical neurochemistry and nutrition. With his extensive doctorate and postdoctorate training, Dr. Khankhanian has helped many patients return to or find their optimal selves without drugs or surgery. He has worked through many challenging cases and has achieved remarkable results with his patients. He specializes in traumatic brain injury, migraines and headaches, dizziness and vertigo, developmental disorders, chronic pain, and autoimmune and metabolic illnesses. As a quote, root cause, end quote, clinician, his only goal is to help his patients find the source of their issues and to fix it permanently. Every patient is unique, and by using the latest research-grade technology, he is able to create a care plan that's tailored to each patient. Instead of taking the batteries out of the smoke alarm, Dr. Khankhanian looks to put out the fire. Look at you. Look at you. I'm going to copy that one day. Dr. Khankhanian's core belief is that holistic care is the future of medicine. His mission is to share his knowledge and practices of this life-changing medicine with his patients. When he's not in the office, Dr. Khankhanian enjoys playing golf, singing, riding bikes, watching the NBA. And I got to tell you, me and this guest of mine went to a couple of NBA games together, playing board games and working out. He loves dogs and has a multi-poo of his own named Oscar. And with that being said, Joey, thank you for being here today.
And thank you for having me. I'm always looking forward to speaking on behalf of what I do, and always looking forward to talking with you on this podcast.
Oh, well, because I know you well, but my guests don't. So we had to go back in the time machine and talk about you, okay? So go back to college. That's not too long ago, was it?
No.
So what was your major in college? And did you always want to do something in healthcare? And how did that lead to chiropractic medicine?
So good question. So all throughout high school, undergrad, everything, I always wanted to be in some type of medicine, whether it was med school, something holistic, kind of like naturopath, whatever it may be. I even tried a dentist.
Well, you have a little Iranian in you, so what a surprise.
That's true, yeah. But after shadowing everyone, including yourself, and even working for my own father, as a psychiatrist, I decided that I wanted to take a more holistic route and find a type of healthcare that matched my ideals. And I love to help people naturally, so that's why I went and gravitated more towards chiropractic.
Well, let's talk about your dad. And I gotta tell you, I love your family.
Oh yeah, they're great.
I gotta tell you, I mean, if I had to adopt, another pair of parents, my wife and I, Michelle, we love you guys. So about your dad, he's pretty awesome. Didn't he influence you a little bit better to go into psychiatry? You know what I'm saying? How come you didn't go into psychiatry specifically?
Well, so he had 3 kids, me being one of them, and wanted all of us to be psychiatrists. But of course, we all worked for him and decided we didn't want to do that.
Is it too much listening?
It was more, I think, it takes a special person to be a psychiatrist.
That's true.
My dad is an amazing person, and he makes it look very easy. Because I worked for him in his psychiatric health clinic for 2 summers when I was in high school and in college. And it was. I mean, it's very rewarding, but a little too much for me. So all the credit to him, but not me.
So there's the broad word. You went into chiropractic medicine, but you're very specific. You mean you're into chiropractic neurology. So can you kind of explain to my listeners and myself?
Yeah.
Well, what is it?
So, I mean, many people, I didn't even know when I first started chiropractic school, I didn't know you could specialize. I always thought it was just, you go to chiropractic school, you're just another chiropractor on the block, That was until I joined multiple clubs on campus and actually found a neurology club. And I learned that you could actually do residency and postgraduate studies to get your diplomate in these certain specialties. So there's actually radiology specialty, sports medicine, neurologist specialty like myself. So there's many different options when it comes to specialties in chiropractic. And again, I didn't even know it existed until I started school there. I was like, I really want to do this. It spoke to me, and I met a few people who really showed me the path. And
So why neurology then? Why not all these other ones that you just mentioned?
Good question. I joined the club, and I did meet someone who allowed me to shadow in his office, and I kind of just fell in love, right? Some people hate learning about pathways in the brain because they're endless. There's, trillions of them.
They're confusing.
They're very confusing.
Yes.
To me, it was like second nature. I was like,
nice.
I love learning about pathways. I love learning about dysfunction in the brain, how to correct it. And I just really found the brain is just an amazing thing. And the thing is, we still only know about 13% of its capacity, which is kind of insane. There's still a lot we need to learn about it.
So can I throw you a curveball question?
Yeah.
I think that, you have so many different people influence you in medicine. You said dentist, medicine, your dad. Yeah. So when you went to chiropractic, yeah, oh my God, I got a tongue twister. I know. There are some stereotypes, you know what I mean? I think one of them that I'm just going to come up with is kind of like, you're going to be cracking back the rest of your life.
Yes.
You know what I mean?
Yeah.
So did you, when you're looking into your different fields, did you have some stereotypes going into it? And did those quickly get diminished once you're working at it?
Yeah. So again, there's always the risks in chiropractic care, which a lot of people look at chiropractic as being dangerous. You know, it can cause stroke, this, that. Again, it is very safe. It depends on who you go to, and there's many different techniques that aren't as invasive. So yeah, my goal was to kind of bridge that gap between chiropractic and the medical world, because I see so much potential in what we do and how we can complement each other. So
I like that.
that's a really big reason why I did the neuro route, because with this specialty, it gives me even more leverage into bridging that gap.
I love it.
Yeah.
So, hey, let's kind of shift gears right now and talk about a disorder that many people get at some time. And I'm going to say the word. Let's talk about a concussion. You know what I mean?
Yeah.
So, floor is yours. Explain, my listeners, including med students, what is a concussion?
So, what is a concussion? I'm going to start off by saying there's no real definition to a concussion, and there is a lot of controversy when it comes to defining a concussion. It used to be that in order to diagnose a concussion, you had to have a loss of consciousness, which we now know is not true. About 90% of concussions occur without a loss of consciousness, and only 10% lose consciousness. And they used to say that you have to lose consciousness for a certain amount of time, which, again, we need to take that out, because that caused many people to go untreated and have persistent symptoms for a very long time until they finally sought treatment. But yeah, basically, another reason why I chose this route was because I saw how many people go mistreated / untreated, and I saw the power of what we can do, and that's really what I love the most. Is I want to help people get that proper diagnosis and get the treatment they need.
You set me up for my next question. So, diagnosis. We talked about definition, no set definition. So, if you want to diagnose a concussion, do you need to get imaging? Do you need a CT of your head? Do you need to do an EEG? Is there blood work to do? What would be the workup, and how would you diagnose it? You know
Good
what I mean?
question. So they used to say that it needed to be diagnosed by imaging, looking for structural damages in the brain. But now the way they diagnose is if you have any type of symptoms associated with concussion and it cannot be ruled out by an existing condition or comorbidity, and you haven't had any other accidents, then you can be diagnosed with a concussion.
So are you going to err? Now I'm just making stuff up while we're talking. Is that getting me pumped up?
Yeah.
I mean, is your first line imaging if indicated CT, or do you go to MRI in some cases, or what's your go-to?
There's a specific type of MRI that we order. It's called neuroquant, which is very specific, and it shows actually the neural pathways within the brain. It's definitely the gold standard when it comes to imaging now, when it comes to concussion.
Nice. So let's do like a little physiology. I love pathophys, you know what I mean? So what actually happens when a concussion occurs?
I love explaining it because I like to use an example of a cauliflower.
Well, why?
You'll see in a moment. So if you think of the brain as a cauliflower, like the top of the cauliflower is the cortex, or the big meaty part, and then we have the stem. Okay? So if you grab a cauliflower by the stem and you shake it around, like a concussion, you think that in a concussion, actually, most of the damage occurs where you hit your head. But through research now, we're seeing that most of the damage happens at the brainstem, at the tip of the brainstem, where most of that torque occurs. And we get what we call is diffuse axonal damage. And when we look at what the brainstem does, this is where we have all of our sensory processing. So visual processing, auditory processing, vestibular or balance processing. So this is where most people experience damage, and where we need to start when we're looking at the concussion.
I love that, because I was one of those other people. I mean, if you smack someone here, I mean, why wouldn't it hurt right here?
Exactly.
But I love that stem of the cauliflower. I didn't know that. You know what I mean?
That's what many people thought for years. So
that's awesome. That's awesome. In general, I don't know if you have this answer or anything, but so how many people experience concussions annually? And let me put you on the spot. What percentage of them suffer from something called a post-concussion syndrome? And of course, you're going to have to explain what that is, right?
I will explain.
Yeah.
So there are about 3.8 million Americans that experience concussion every year.
That's a lot.
It's a lot, yeah. And what's worse than that is that about 50% of them go untreated.
Oh boy.
Which can lead to what we call post-concussion syndrome. So now what post-concussion syndrome or PCS is diagnosed as and how we look at it is if the patient basically has symptoms after concussion and goes untreated, a lot of times their symptoms persist or become worse. For example, I had a patient that was in a terrible car accident and had an open case for a while, but no one diagnosed her with a concussion or treated it. And until she came to our clinic and I diagnosed her with post-concussion syndrome, we treated it and she was better just in a few months.
So I got to know. So I know the answers can be very broad and it depends, but what are some of the core symptoms and signs when you have a post-concussion syndrome?
Yeah, it's a good question. So,
Thank you. I always love a little compliment.
Oh, yeah. So we're looking at, the three main symptoms after concussion are headache, nausea, and dizziness. Okay. But then there are many more, such as light and sound sensitivity, anxiety, depression, frustration, irritableness, focus issues, concentration, memory. I can go on and on with these symptoms. They're very nasty. But yeah, basically these are the signs and symptoms of concussion. And again, if they go left untreated, we will diagnose you with post.
Does it ever feel like you're a marketing professional just
speaking into the void?
But with LinkedIn ads, you can know you're reaching the right decision makers, a network of 130 million of them, in fact. You can even target buyers by job title, industry, company, seniority, skills, and did I say job title? See how you can avoid the void and reach the right buyers with LinkedIn ads. Spend $250 on your first campaign and get a free $250 credit for the next one. Get started at linkedin.com/campaign. Terms and conditions apply.
Oh, Hilton stay, oh, Hilton stay. Your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, oh, Hilton stay. A holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
So now once again, I'm going to throw you off your game right here. So are there patients out there, and it's going to be scary if you say yes, that may have had the damage to injury much, much earlier, and they go up an excessive amount of time and they have undiagnosed dizziness, fatigue, whatever you just mentioned. And by getting a good history, like this could have been a sequela of something that happened earlier.
Yeah, exactly. And the scary thing is that the longer they go without treating it, sometimes the harder it is to treat it. So that's where I am very grateful to be the first person to come to, because I often can diagnose and treat it early. But sometimes, at one time I had someone that came after 10 years and he's like, I'm having seizures, and they haven't figured out why. And through his history, we found out he had multiple concussions as a child. And after doing our diagnostics and some imaging, we realized that he was having these seizures because of some functional issues occurring in his brain.
Now, once again, this is not one of my preset questions. I mean, do athletes go through this?
Yeah. Many athletes. Actually, a lot of my patients are athletes, mainly football, soccer, basketball, of course. And yeah, it's awful because many of them happen at a young age, and a lot of doctors just brush it off. They're like, "Oh, just go home and rest. You'll be fine. Just sleep it off." And then they continue to have issues until they finally want to come to me or another specialist to get them fixed. So.
And the reason why I'm not surprised, I got my little girl, Mina, you know what I mean? And she plays basketball and all these different sports. So I go and watch sometimes. And I never realized kids play really hard.
They do, yeah.
Maybe it's those parents, but I was like, oh my God,
Actually, many concussions go misdiagnosed at a very early age, unfortunately.
So, okay, I like this one. This is a good question.
Yeah.
So, you mentioned earlier about definitions and about losing consciousness was not was historically part of the definition. But what percent of people actually do lose consciousness when they get a concussion? Can you give me a ballpark?
Yeah, so only 10%, about 10%.
Just 10?
Yeah, very low.
Okay.
And that was the criteria to get diagnosed with a concussion back then, which is awful.
So let me ask you this. So if someone's got head injury, anyone, let's say I went skiing and I suck at it, but let's say I hit my head, what questions should you ask following head injury just to make sure that you're not going that route towards concussion?
Yeah, I will ask if after the accident occurred, what they felt immediately afterwards. So a lot of times they will say, I felt dizzy, nauseous, headache, disoriented. And then we see how they feel throughout the week. Again, a lot of it is symptoms, a lot of it is subjective. And then after that, we will do a lot of functional tests just to rule anything in or out, get some imaging done. Even though I'm going to add this in, a lot of times, around like 90-95% of the time, imaging doesn't show anything, which I'll get to in a little bit.
Okay, sure.
Yeah. But basically, it does take a lot of functional testing and proper neurological testing to see whether or not there's a concussion or not.
So I got to ask, because I'm not sure, what would be some functional testing?
Yeah, so we use like video nystagmography testing, video head impulse testing. Video head impulse testing, that. We use computerized posturography. We do a lot of cognitive tests.
Wow.
And then that comes with the basic neurological and physiological tests as well.
I don't know if I could afford you. Wow, that's a lot of testing. So let me ask you, we're talking about damage and we're talking about, head injury. Mm-hmm. So terminology, structural damage and functional damage, you know. I kind of read this somewhere, but I didn't understand it. Can you explain it to me and my listeners?
Yeah, so when it comes to structure versus function, again, we look at imaging, which a lot of times people use in the past to diagnose concussions, which is wrong for what I previously stated, because around 90-95% of people don't have any damage structurally after a head injury, and their MRIs or CTs are normal. When we look at function, again, we want to look at their visual function, vestibular function, basically looking at pathways in the brain and how those are functioning, because they may look normal on MRI, but how they're actually working can be completely abnormal or dysfunctional.
So that's what they're referring to. If you're just looking for structural damage, here's an image, look at the image while you're saying, looking for the functioning of these areas, these pathways.
So that's where we use video nystagmography, video head impulse testing, computerized balance posturography, stuff like that, to really test these areas of the brainstem and your cognitive abilities, to see what might be going on and how we can fix it.
Okay. So this one I put in my questions because you wanted me to ask you this one. This one I really wanted to hear you answer. The 6 phenotypes.
Oh, yeah.
So you wrote 6 phenotypes that you test for within concussion. I didn't even know there were 6 phenotypes. Can you explain it? And why? How does it make a clinical difference and treatment difference?
Yeah. So there are 6 different types of concussions, or 6 different categories. You can have all of them. You can have a few of them, there's one, but it's important to look at all of them and check for all of them, because if one goes missed, it can cause an array of symptoms. So when we do our testing with all those diagnostic tools I said, the 6 that we want to look at are vestibular system, your visual systems, your proprioceptive systems, autonomics, your limbic centers, and cognitive centers.
So give some examples. There's so many medical words that maybe some people didn't catch there.
Definitely.
Start with vestibular. Work your way down.
We'll make it. So vestibular, which is your inner ear systems. Okay, this is the top priority.
Okay.
Your vestibular system. Say that word 10 times. So your vestibular system, which is your inner ear systems, which I'm sure a lot of people have heard, the inner ear plays a really significant role when it comes to balance. But what a lot of people don't realize is the vestibular system has the most influence on your entire nervous system and brain, and it is usually the first to go after a concussion, and the most dysfunctional. So that's why most of our testing actually is around the vestibular system and seeing what's wrong there. Now, what can happen when you have vestibular dysfunction? It can lead to balance issues, of course, dizziness, but through research now they're saying the vestibular system has a very important role in cognition, memory, focus, stuff like that. So, I mean, a little off topic, but
not.
Yeah. For example, people with ADHD or anxiety, stuff like that, they're starting to look at the vestibular system as a culprit in terms of what may be causing those symptoms.
That's interesting.
Which is very interesting. This is all new research, but it's good to include. But back to the phenotypes. Yeah, vestibular system is the top priority, and that's what we want to check always. When we check all of them, but that's the main thing we want to focus on. Next is the visual systems. Okay. That's where we do a lot of eye tracking tests. We do rapid eye movement tests. Pursuit, or like just watching the eyes move, gaze stability, seeing if the eyes can just focus on a dot. Stuff like that. Because again, this can lead to dizziness and lead to a lot of symptoms within concussion. Then we have the proprioceptive systems, which is an understanding where our body is in space and how we perceive our environment. This is also a place that experiences a lot of dysfunction after head injuries, and we want to make sure that people.
Isn't there a medical sign where you make the patient stand up with their hands out and you're closing your eyes?
Yeah. So we call that the.
There's a name for everything, and I'm drawing a blank. And I
so
teach
there's Romberg.
Romberg. Thank God, there's a neurologist here to help me with this.
So Romberg is one of our tests. And then we'll check different canal positions. So don't want to get into too much detail, but
that was my fault.
It's okay. But yeah, that's another area that we really want to check. Then on to autonomics. So a little background into what autonomics are for the viewers. The autonomic nervous system basically is within our brainstem and plays a very important role when it comes to blood flow. I'm sure a lot of the viewers will understand fight or flight versus rest and digest.
Sympathetic versus parasympathetic.
Yes, got it. Yes. So a lot of times after head injuries, because the brain is in this alert mode, it gets stuck in that fight or flight or sympathetic mode. So you're not having proper blood flow in the body.
Everything's like clamped down.
Yes, everything is in alert mode. That's why many patients actually feel dizzy or have dysautonomia, which is another big word, which basically just means you're not getting blood up to your brain properly. That brain to heart connection is not where it should be. So a lot of times after concussions, people get dizzy upon standing up too quickly, stuff like that. They get tired or fatigued if they exercise for too long, stuff like that. So, and then next is limbic system. So this
I'm fired up for the limbic system. How do you explain this one?
So limbic system, So this is why many patients feel, a lot of severe anxiety, depression after head injuries. They lose motivation. Often, they can't sleep at night, stuff like that, because these areas lack inhibition, which lead to excessive thinking, panic attacks, stuff like that. So that's where
you should get your dad involved.
I was just gonna say, this is where the psychiatry or psychology, whatever it comes in. And that's why a lot of times we will refer patients as needed to see a therapist or psychologist, because there is the post-traumatic stress that comes after a concussion a lot of times.
And I'm not making this up. Me and you will probably be friends down the line, because isn't sleep a big part about what happens to some of the people with these traumatic brain injuries?
Yes. Yeah. So that's where we really want to look at all these phenotypes, because if any one of them is not functioning correctly, it can lead to sleep disturbances.
I can just only imagine that. Imagine that. Is there another phenotype?
There's cognitive.
That's bad.
Frontal lobe.
Okay,
again, for the viewers, frontal lobe we know is associated with personality, executive function, memory, stuff like that. So we really want to look at this area, because a lot of times patients lose that focus, motivation. They lose parts of their personality after head injuries. It's actually very sad.
Are people with traumatic brain injury at a high risk for developing dementia?
Yes. Yes. Sucks. Sadly, because of the damage and the tissue damage and these functional damages that can occur, sadly if it goes untreated, it can lead to high risk of dementia, issues like that.
So it's going to be hard to answer it for everything you do, but I think what separates you is the fact that you're focusing not just on traditional medical treatment. So your approach, your company's approach, what you believe in, what are some of the diagnostic therapy modalities that you do compared to traditional medicine?
Good question.
All right.
So I kind of stated before, when it comes to traditional medicine, someone goes in, sees their medical neurologist or primary care.
Yep.
A lot of times they will either give some medications to help with the symptoms,
Sure.
like sleep or
Okay.
pain, stuff like that, nerve pain, dizziness, stuff like that.
Gabapentin.
Yes.
Pregabalin.
Pretty much all my patients are on that. Yeah, and then that's where actually we started reaching out to a lot of neurologists because we know that they're limited.
Yeah.
So they can usually diagnose it and they tell them to just rest, go home, just take off from work if needed or not. But time will go on, and a lot of times, like I said, with post-concussion syndrome, again, 60% of people that get concussions will continue to have these persistent symptoms, and they need proper care. So that's where they come to us, and this is what's the difference between us and traditional care. We take a full look at the brain, again, checking all these phenotypes, doing all our functional tests, like I said, checking the eyes, inner ears, cognition, proprioception, full neurological, physiological tests, and just checking pretty much every part of your nervous system to rule out any issues. So, and then after that, we will do a lot of therapies, modalities such as vestibular training, visual therapies, working with the brain and the body, getting them back on the same page, doing cognitive therapies, a lot of fun brain games, balance therapies, and even things such as hyperbaric oxygen therapy, which
you did mention that to me.
Yeah. So that's something that's up and coming. Not too much research on it when it comes to traumatic brain injury. Most of the research behind it is in neurodegenerative disorders, like Alzheimer's stuff.
Now, does your place have one of those bad boys?
Yeah, we do. We just got
a room or just an individual chamber?
It's a room with a chamber.
Okay.
Yeah, the chamber's in it.
Yeah.
Basically, we put a lot of patients with concussions in this chamber because it's basically what it is. You go in there and it puts ambient air in there in that pressurized environment to the point where oxygen is being pushed through your skin and into your body, your brain, all your organs. And we also give you pure oxygen through a cannula in your nose. So you're inhaling pure oxygen while you're getting it basically flushed through your entire body. And it's worked wonders for many patients that have TBI.
That's great. Yeah. For me, it's having options out there. You know what I mean? Because you're right. I think being a doctor that predominantly does Western medicine. Yeah, you're right. I'm very heavily reliant upon, hey, what did my journal article say here, and what is this? And not to say that doing alternatives isn't, but it's nice to give patients hope that there's other stuff out there.
Exactly.
And playing together in the sandbox is always nice. You know what I mean?
Yeah. So that's why I love actually a lot of neurologists. They refer patients to us. Who home manage. A lot of chiropractors too, who have a hard time with complex patients. They will refer them to us, and I love working together. It really takes a village. And again, back to my goal of bridging that gap. It was always my goal to work both sides and help Western medicine and our side of medicine work together to
That's great.
Help as many people as we can.
So a couple of quick ones and I'll let you go. So, I love that you're opening your own business. I'm super beyond proud of you, so that you know that. So why are you opening your own business instead of joining a group? What's been the hardest part so far of doing it?
Well, my dream was always to be my own boss. And I attribute a lot of this to actually my last boss. He equipped me with all the tools, and that's why I have so much respect and admiration for him. He gave me the courage to really open my own practice and encouraged me to, because he really taught me A to Z concussions, all any type of brain condition, seizures, developmental disorders, dizziness, vertigo, migraines, how to treat them and what to do with them. And there were many groups that I could have joined, but I felt confident enough to treat all these people on my own, and I had a great opportunity to do so here in LA. So,
my wife, Michelle, her dad passed away, and I loved him dearly. He was a cardiologist, and he didn't join no group. He had his own practice. And I always, and me, I love being part of a group and teaching and blah, blah, blah. And, he always kind of chuckled. He's like, you do what you do, Raj. I love having my private practice, And only now, as I've been, practicing for quite a while, I love that he did private practice. It's hard, but you're your own boss. no one tells you what to do.
It's true.
Oh my God. I understand now.
Yeah.
And I'm just really proud of him. So I think you really did choose wisely. I think it's not an easy route, but I think you chose wisely.
It will be harder, but in the end, I know it will be very rewarding and I get to take off as much time as I want.
You can bring me to some Laker games, right?
Yeah, I'll take you to Laker games too.
So hey, what are your goals in the future? Now I know it's kind of early in what you're doing.
Yeah.
What do you see? Let's make it about 10 years from now. How's that?
My goal is to have a huge facility, multiple doctors, seeing multiple people, maybe even hiring some medical neurologists to work in the office as well to get that side of healthcare in there as well. Yeah, I want a very big office, treating as many people as you can, to help as many people as you can as soon as we can, so they don't continue and live a life that's not as optimal.
And the last thing, people who listen to my podcast, not everyone has to go to med school. I'm proud that my podcast says people just love stories and go to different aspects. Someone's going to go into chiropractic medicine from this. So can you give me or my listeners any tips if you want to go into chiropractic medicine or doing it currently? Can you give them some tips about that?
Yeah. So definitely specialize if you go to chiropractic school.
Okay.
You can be another chiro, but definitely specialize like I did, whether it's radiology, upper cervical care, neurology, sports medicine, stuff like that. Because the more you specialize and the more you narrow down what you do, the more niche you'll be and the more people will respect you and what you do. So,
I love it.
Yeah.
So, number one, let me say a couple things about your grand opening. I know it's going to be when? When is the date?
It's September 7th, Thursday, September 7th.
And I love your name, SoCal Brain and Spine Center.
Yes.
I like that. With Dr. Raj. That's what you're missing at the end.
Yes. Hey, one day, in my big facility.
So it's located in 1141 North Grand Avenue in Glendale. And you know what? I'm going to put all that info on our notes for our podcast. But hey, Joey, I think you're just an awesome person.
Thank you.
I've always loved being your neighbor. I've seen you literally grow up. And my wife and I are just very proud of you.
Thank you. Well, it takes an awesome person to know.
You're great. Well, everyone, hey, thank you for listening to this week's Dr. Raj podcast. Stay tuned for our next episode coming soon.
Thanks for listening. This has been a production of Ars Longa Media. Our producers are Madison Linden and Chris Brightigan. Our executive producer is Dr. Patrick Beeman. This podcast is for educational purposes only and not intended for medical advice. Ars Longa, Vita Brevis.
So you want to start a business. You might think you need a team of people and fancy tech skills, but you don't. You just need GoDaddy Aero. I'm Walton Goggins, and as an actor, I'm an expert in looking like I know what I'm doing. GoDaddy Aero uses AI to create everything you need to grow a business. It'll make you a unique logo. It'll create a custom website. It'll write social posts for you and even set you up with a social media calendar. Get started at GoDaddy.com/Aero. That's GoDaddy.com/AIRO.